Hey, are you okay? Wake up, wake up. Hey, come on, wake up. Come on, wake up. You alright? Hey, wake up. Wake up, come on. Wake up right now, wake up. I need help. My friend's not responsive, please. My friend's unresponsive. I'm giving Narcan. We're at 123 Memory Lane. Come on, wake up, wake up. Wake up. Wake up.
Treating opioid overdose. How to use Narcan. Presented by the Center for Health System Analytics at the School of Biomedical Informatics at the University of Texas Health Science Center at Houston.
This pretend patient had an opioid overdose that was utterly avoidable. He suffered a back injury at work and was prescribed opioid pain medications by his doctor. The medicine worked, but only for a little while, and he ended up needing stronger opioid medicine more often. He struggled to get off the drug, but the withdrawal was too severe. Eventually, he required so much medication just to feel normal that his prescriber cut him off. Then his only option was to buy his medication off the street, and when that became too costly, he started injecting heroin. This is an all too real cause of overdose. Hi, I'm Dr. Tom Fadile, an emergency room physician with the McGovern Medical School at UT Health. I'm also associated with the Houston Emergency Opioid Engagement System, called HEROES for short. Opioids are drugs derived from the opium poppy or created with chemistry to mimic opium's effects. One example is morphine, used to treat severe pain after extensive surgery. Heroin is an illicit or illegal drug. People often use heroin when their prescriber removes or curtails their ability to get additional medically prescribed opioids, but they need opioids to prevent withdrawal. Heroin is often easier and cheaper to use than prescription drugs purchased illicitly. Your body has receptors, shown here on a nerve outlined in pink, for opioids that are released naturally, such as when you have runner's high or you kiss on a first date. The receptors bind to opioids and activate the pathway. Opioids affect pathways involving pain, breathing, mood, digestion, and even itchiness. Opioids, whether made by the body or taken by a person, have a variety of effects: pain reduction, slowing or stopping breathing, sleepiness, feeling high, that is happy and relaxed, vomiting and feeling like you're sick to your stomach, lowering testosterone, reducing the speed food travels through the bowel, causing constipation, reducing pain associated with a heart attack, and opioids can cause itchiness. Opioid tolerance occurs when the person using opioids must take a larger dose to achieve the same effect. Whether that desired effect is pain relief, as was the case for our patient at the beginning of the video, or if the opioid user wants to repeat the euphoric high opioids provide to improve their mood. Tolerance may occur when the body adjusts the number of opioid receptors on nerves in the various nerve pathways in the body, such as pain or pleasure pathways, to counteract the effect of repeated exposure to opioids. The result is, it takes more opioids to cause the same effect. Unfortunately, this doesn't happen at the same rate for all opioid pathways, such as the pain pathway, as it does in the respiratory pathway. Increasing the opioid dosage may reduce pain, but breathing may also stop. An overdose occurs when breathing is too slow to sustain life or breathing stops altogether. So here are a few more terms to increase our understanding. Opioid dependence. When someone who has become dependent on opioids hasn't taken the next dose the body expects and then feels cravings, which can cause opioid withdrawal. People who use opioids describe withdrawal as being 10 times worse than the worst case of flu. People in withdrawal may experience sweatiness, tremors, the jitters, nausea, vomiting, itchiness, diarrhea, tearing, and an intense craving to use opioids. Opioid use disorder is used to describe someone who is unable to reduce or stop their opioid use, even though their use interferes with their obligations at work, school, or at home, with resulting social problems. Withdrawal frequently occurs when someone has developed opioid tolerance and opioid dependence. Welcome to the McGovern Medical School Simulation Center, where we teach medical students on a variety of medical procedures. It's a great place to teach you how to use Narcan. Let's examine ways to prevent overdose. One primary method is to reduce or eliminate opioid use. People who have serious injuries or surgeries can use a combination of therapies to control pain, such as acetaminophen or Tylenol, ibuprofen or Motrin, or a wide range of other effective treatments that target the nerves responsible for transmitting pain or reducing the brain's perception of pain. These include gabapentin, lidocaine, ketamine, and procedures that numb painful nerves. Non-medication alternatives can also reduce pain. According to the American Society of Anesthesiologists, some valuable techniques include physical therapy, acupuncture, surgery to correct pain caused by abnormalities, and massage. There are more, and everyone should work with their physician to use these alternatives to help avoid opioid dependence. A critical method in preventing accidental overdose is to keep all medications, including opioid drugs, in a secure location where kids can't get them. Leaving opioids or other meds on the counter in plain sight is a convenient but dangerous strategy. I treat young kids for opioid overdose, so I know that keeping your drugs secure is crucial to control this. Securing opioids can also prevent the misuse or theft of opioids, which is vital to keep drug-seeking teens or adults from finding them. Now that we've learned some methods for preventing opioid overdose, let's discuss what you can do if you discover someone who may have overdosed. At the beginning of the video, we showed you someone treated for an overdose, but now let's break it down to reveal the thought processes and steps taken to treat this emergency. When you get to any emergency scene, it's essential to secure the scene. This means checking that there are no other hazards to you, to bystanders, or to the person who needs help. Assessing hazards includes ensuring bystander safety, including unnecessary exposure to viruses when doing CPR. You should wear a mask following current CDC guidelines during the COVID pandemic. Use an N95 or KN95 mask if you can, since you're treating a medical emergency, and wear gloves. You'll have to tailor this to the scene and the situation since you might be treating someone who is living with you. The first thing to establish is whether the unresponsive person can be awakened by yelling. Wake up! Wake up! Hey, wake up! If not, then use a sternal rub. You do this by rubbing hard on the breastbone in the center of the chest with your knuckles. If no response or the person needing help goes right back to sleep, get help by calling 911. Somebody please get help, my friend's unresponsive. If you are alone, do this yourself. My friend's unresponsive, I'm giving Narcan. We're at 123 Memory Lane. Next, open the airway. Now, listen for breathing. If the person isn't breathing or is only gasping, begin CPR with compressions. If you have an AED, they can help keep a person alive if the heart has stopped or is beating erratically. If normal breathing is present, stay with the patient and continue to monitor them until help arrives. Now, give Narcan. Remove one of the nasal spray devices from the box and open the blister pack. Hold the nozzle between the first and second fingers with your thumb on the plunger and put the nozzle in the person's nose. Make sure your fingers are at the bottom of the nostril and the tip is inserted well into the nostril. Using your thumb, press the plunger completely in. When done, dispose of the device. The goal of reversing overdose is returning the person to breathing on their own, not that they are fully alert. Giving too much Narcan can place a person in full withdrawal, which is highly uncomfortable for them. But if they haven't started breathing well on their own in 2 to 3 minutes, give another dose of Narcan, this time in the other nostril. Be aware that Narcan is only effective in the body for 30 to 90 minutes. Depending on how much, how potent, or how long acting the opioid is, determines if or when the person who has overdosed might stop breathing again. The takeaway is to give enough Narcan to allow the person to breathe on their own, but to stay with them until EMS arrives because long-lasting opioids can regain control of the opioid receptors and cause breathing to stop. Maintaining breathing is the most important reason for a person who has overdosed to get treatment from EMS and get to a hospital. One more thing, when the person who overdosed begins to breathe on their own, place them on their side, with their head tilted back to help them keep their airway clear. This is especially important if you must leave the person. So that's the whole process of rescuing someone from an opioid overdose. You've seen it twice now, and you can repeat this segment until you feel comfortable that you can help. So we've seen what to do if the person who overdosed responds slightly when you try to arouse them, and so doesn't need CPR. But what do you do if there isn't any response at all? Just grunting breaths or no breaths and no response to a sternal rub? The answer is uninterrupted CPR using chest compressions at the rate of 100 compressions per minute. If you're alone and the patient is unresponsive, it is critical to keep CPR going and supplying oxygen to the brain rather than spending time giving Narcan. Some limited studies have shown that chest compressions do not produce a large volume of virus exposure, but to be safe, you should wear a mask if the person you're helping doesn't live with you. And you should put a mask on the patient as well. Remember, you give at least 100 compressions per minute, equivalent to beats in the song Staying Alive, and press down at least 2 inches for each compression, according to the new 2020 American Heart Association guidelines. If you aren't yet certified in CPR, please get training. If you know you are around someone who uses opioids, this too can be life-saving. One other aspect we should cover is what to do in a public place with many bystanders around. In this situation, if the unresponsive person can still push your hand away but isn't breathing normally, give Narcan and repeat in 2 to 3 minutes. But if the unresponsive person isn't breathing and has no response to a sternal rub, have someone call 911, have someone get the AED, and have someone else give Narcan while you start compression-only CPR. Wake up! My friend needs help. You call 911. Okay. You get an AED.
Okay.
You find some Narcan.
All right.
I went ahead and called 911. They said they're on their way.
Thank you.
I found the AED.
Great.
Set up.
Thank you.
Ready to put on the pads?
Uh-huh.
Resume CPR.
Unit OK. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Don't touch patient. Analyze it. Don't touch patient. Analyze it. Shock advised.
Gonna give a shock.
Don't
Yeah,
touch
shock.
patient. Press flashing shock. Shock delivered. Start CPR.
Give Narcan. Going to administer Narcan. Narcan administered.
Thank you. AEDs, or automatic external defibrillators used to detect and correct heart irregularities, and continuous CPR are the best predictors of meaningful recovery when the patient's breathing is too slow or their heart has stopped. You've done something amazing by rescuing the person who overdosed, but just because they're breathing doesn't mean they're out of the woods. Here's what happens next. Opioid overdose can cause some severe problems: brain damage that causes difficulty in thinking clearly, damage to the kidneys or heart, and vomit can be inhaled into the lungs, causing pneumonia. And every person who has overdosed is at an increased risk of repeat overdose or fatal overdose and therefore needs continued help. Here at 𝐏𝐫𝐞𝐳, we have a unique relationship with the Houston Fire Department, and we have asked one of their experienced paramedics to show you what happens inside the ambulance after an overdose. Here's my colleague, Ashley Mackey, who is a firefighter paramedic with the Houston Fire Department.
Thanks, Dr. Fadile. Welcome to my office. My desk has a sheet on it. The first thing I do for someone who has overdosed on opioids is to make sure to counteract the lack of oxygen overdose patients experience, so I put an oxygen mask on them and give them O2. Next, we do a full assessment to see where the patient is at that moment in time. I count their heart rate, breaths per minute, take their blood pressure, and assess their level of consciousness. I log all this data as a baseline to monitor and ensure that the patient isn't losing ground while they're in the ambulance. I need to make sure any remaining opioids don't overwhelm the person's breathing as the Narcan wears off. Then I'll start a line to put fluids into the patient's system. This is so I can easily give more naloxone, the drug in Narcan used to reverse the overdose. I can also use this IV line to give cardiac medications if the patient's breathing stops or they need CPR. Because the people who have had CPR or who are waking up from overdose frequently vomit, I'm also ready to protect the patient's airway with a special tool called a supraglottic airway device, so they don't inhale vomit into their lungs. While we transport the patient rescued, I continue to monitor the patient's vital signs and provide a comprehensive report to the physician when we get to the hospital. As Dr. Fadile will tell you, emergency department physicians use the baseline information to decide how to provide further treatment. Your willingness to provide care to someone who has overdosed on opioids gives them a chance to breathe again and gives me a better chance as a paramedic to get them to the hospital alive. Before I turn back to Dr. Fadile, let me remind you of two things. One is you can give Narcan to anyone who is unconscious for any reason. And two, do not squeeze the plunger of the Narcan until the nozzle is in someone's nose. Dr. Fadile will now discuss what happens at the hospital when someone overdoses on opioids. Thanks.
Thanks, firefighter paramedic Mackey. As paramedic Mackey said, a lot of things need monitoring and treating when someone overdoses on opioids. When the person who overdosed gets to the hospital emergency room, I look at their current situation and see if the person is improving or worsening based on the report from the ambulance. For a patient who is improving, I start continuous monitoring to get beat-to-beat information about their body and evaluate for complications such as lung injury, brain damage, or toxicity from non-opioid drugs. I then treat the patient for opioid withdrawal signs and symptoms like anxiety, nausea and vomiting, diarrhea, generalized body aches, muscle pain, and high blood pressure. Basically, I help them through the agony of opioid withdrawal by making them as comfortable as I can. After enough time has passed and based on which opioid they were exposed to, I start these patients on a drug that prevents additional withdrawal symptoms. For patients who are getting worse, and by that I mean who aren't breathing well or who are having other issues which affect whether they are going to survive, I start an IV with continuously administered naloxone to make sure that the opioids in their system can't cause their breathing to slow or stop. If the patient's not breathing well, I also place them on a ventilator to ensure they receive enough oxygen. In both cases, if the patient recovers well enough to be discharged, any person who has overdosed receives a box of Narcan, instructions on how to use it, and a referral to an opioid outpatient treatment facility. To illustrate why we make this referral for outpatient treatment, I'd like to introduce you to two of my colleagues here at the Houston Emergency Opioid Engagement System. First, Jessica Yeager, the Peer Support Services Supervisor and a recovery coach at Heroes, and then Dr. Andrea Yatsko, who is a faculty member and program manager providing outpatient treatment for folks enrolled in the Heroes Outpatient Opioid Recovery Program.
After someone has been rescued from an overdose, been treated at the hospital, and discharged, we reach out to each person who has overdosed on opioids. We work as a two-member team made up of a community paramedic like Ashley, who you met earlier, from the fire department, and a recovery coach like me. We use a list of people who have overdosed, generated by the fire department, and go to the person's address and invite them to enter into our program. As Dr. Fadile mentioned, my name is Jessica Yeager, and I go out each week and help people all over Houston understand why entering treatment can improve their situation. I have lived experience with addiction, and I'm currently clean and sober, living a life in long-term recovery. I have dealt with challenges that people in recovery face, and I can talk to them and encourage them to establish new thinking and perspectives to help them achieve their goals. Overall, we work towards a goal of harm reduction and realize that recovery doesn't always happen on just one idealized path.
Hi, as Dr. Fadile mentioned, my name is Dr. Andrea Yatzko, and I supervise our outpatient treatment program here at Heroes, an opioid recovery program at the University of Texas Health Science Center at Houston. Once someone has agreed to enter treatment in our outpatient program, we provide counseling, both individual and group sessions, and long-term medication for opioid use disorder to prevent opioid withdrawal while assisting with long-term sobriety. We also assist people entering into recovery connect with safe, healthy, and sober living arrangements that allow recovery to take place, and also assist with info about signing up for healthcare benefits they may be eligible for. Our program provides continuing support from our team of recovery coaches like Jessica and her team, who help with the genuine challenges faced by somebody in recovery, and clinical staff who create a treatment plan and set goals with all patients. Overall, people who enter treatment for opioid recovery have success rates similar to the treatment success rates for other chronic diseases such as asthma, diabetes, and hypertension. The inclusion of medication therapy helps avoid physical withdrawal symptoms, as well as providing stability for the brain and body to repair from active addiction. Our recovery coaches, clinical chemical dependency counselors, nurse practitioners, social workers, and coordinators work with people in opioid recovery to help achieve the harm reduction goals people establish for themselves. The person who overdosed on opioids has an opportunity to change, to address their opioid use disorder with the support of medication, clinical staff, coaches, and counselors, which greatly improves the chance of reaching each person's goal for recovery.
Thank you, Dr. Yatzko and recovery coach 𝐏𝐫𝐞𝐳. I'd like you to know that even though the numbers related to opioid overdose cause genuine concern, there are reasons for hope. As shown here, 49,860 people lost their lives in 2019 in the U.S. due to opioid overdose, as reported by the Centers for Disease Control and Prevention. But we're working daily to confront the stigma associated with opioid treatment, and we need to enlist you in this effort. Opioid use disorder, what used to be called opioid addiction, is a chronic disease no one wants, just as no one wants asthma, high blood pressure, or diabetes. As Stephanie Knack wrote in 2019 for the Mental Health Commission of Canada, stigma, or expressing negative feelings and attitudes towards people with opioid use disorder, prevents people from entering treatment, prevents people from taking medications that are part of the most successful methods of treatment, and from allowing people to contribute their skills and talents to society while they are in recovery. Dr. Knack continues that stigma also affects those who care for people who use opioids. So we all need to be aware and strive towards preventing stigma as we help people with this treatable disease. I know that one reason for stigma is a feeling of hopelessness resulting from a misunderstanding that chronic diseases can't be treated successfully. As stated, opioid use disorders are treated successfully, and other reasons for hope exist. I know that anesthesiologists have discovered very effective ways to control pain without using opioids at all, or with minimal opioid use over brief periods. These alternatives help prevent opioid tolerance and the resulting desire to increase the amount of opioids used. There is hope because medications used to prevent withdrawal during opioid use disorder treatment are effective, thus avoiding the agony of opioid withdrawal. This allows recovery, and maintaining the medication as recommended allows the brain and body to continue to stabilize over time. And there is hope because you have learned what opioid use disorder is, how to treat an opioid overdose with Narcan, and what treatments are available for people who use opioids and want to address their opioid use disorder. If you need Narcan, need to replace expired Narcan, or if you use Narcan to treat an opioid overdose, please contact our colleagues at morenarcanplease.com. They'll ask you to fill out a completely confidential survey and send you Narcan for free. So there you have it. You've learned how to give Narcan in a variety of situations. If the person needing aid is unresponsive, if they need CPR, and if they are found with lots of people around to help. You've also learned why opioid overdose occurs and what happens after the rescue, in the ambulance, in the emergency room, and during long-term treatment. Finally, you've learned why there is hope for people who have opioid use disorder. By having a Narcan kit available, keeping gloves, masks, and a cell phone handy, and knowing how to use them, you are helping prevent opioid overdose deaths. Thank you.
If you or someone you know needs help with opioid use disorder, please call the Heroes Helpline at 833-367-4689 or email us at heroes@uth.tmc.edu.